Hello everyone. Today we want to present our results about our scientific research predicting the risk of the surgical complication based on multiparametric neural network clustering, revascularization of the main arteries of the lower limbs. Application of information methods and computer modeling in modern conditions make it possible to significantly improve the quality and provide a comprehensive approach to the choice of surgical intervention, especially in the field of the vascular surgery, which required a large amount of information and parameter analysis. So for now, we need to develop a unified scale of possible risk of surgical intervention has become extremely important. To form multiparameter neural network clustering, followed by development of the risk stratification scale for surgical complication, we have performed analysis of the examination indicators of 411 patients with obliterated atherosclerosis and use NOVA methods like ultrasound, tomographic computer, and of course in the vascular operating room with X-ray. For more in-depth analysis of combined change in the indicator group in observation studies and in order to optimize the predicting of the risk of developing complication in the postoperative period, we have performed a neural network clustering using neural Excel classifier added in the Microsoft Excel program. We have analyzed clinical observation results, laboratory and instrumental studies, which we entered in the neural network clustering system was processing. Besides, we have analyzed anamnesis, clinical and laboratory indication of 72 patients. There is group 1 open surgical intervention subgroup 1A have been used to treat 44 patients, and then the vascular intervention subgroup 1B to treat 28 patients. We also carried out analysis of ultrasound examination indicator of 47 patients at the second group who underwent open and vascular surgical intervention. All the patients were diagnosed with an insignificant stenosis at the level of the aortoiliac segment. However, a significant stenosis occlusion at the level of the aortoiliac segment was not detected. So, according to the research, the patient of the first cluster have the highest level. It is about the anamnesis cluster, anamnesis indicators. So, with the help of cluster portrait, we found the cluster has showed the highest age indicators, lesion of the extracranial arteries, diabetes, sub and decompensation stages, and respiratory failure. The rate of stroke in the anamnesis exceeds a similar rate in third cluster, and the rate of disease of the cardiovascular system exceeds the rate in the second cluster. Also, the results of indicating cluster of the laboratory instrumental examination. So the highest number, there is erythrocytes, monocytes, creatinine, AST, LT, bilirubinum, low density lipoproteins, cholesterol, in the case of urea and prothrombinum according to week, exceeded those in the first clusters and percentage of them. We have also performed neural network clustering of the ultrasound study result and receive the next result. So the lowest value of femoral segment patency, 60%, perineal patency 1.3, ankle brachii index 2.5, the posterior tibial artery patency 2.1, and anterior 2.3 in the third cluster was lower compared to the first cluster. So after that, and based on the results, we obtain result of the neural network clustering can be included into neural Excel classifier program, and at the same time the limit value of the indication are defined on the basis of values defined by patient cluster. It should be noted that by adding to the scale indicator, they are not allocated to the most important groups predicted based on clustering, but are the risk factors for development to results of them studies. A minimum coefficient of 1 was defined to unify the definition of the risk levels. All coefficient values were converted into 10-point scale according to the research direction, with formatting of scale for anamnesis table 2, laboratory table 3, indicator of symptomatic ultrasound table 4, and contralateral ultrasound table 5 patient, the maximum number respectively was 40 points. Indicators of all clustering anamnesis such as anamnesis, laboratory ultrasound examination, symptomatic and contralateral limb indication have been included into an Excel classifier in order to define the values of their points. Name of some indication, including ultrasound, have been adapted to facilitate the use in the vascular surgery department. So right here we see the cumulative scoring system for assessing the risk of developing complication. There is for all of the anamnesis parameters, indicators and score, laboratory indicators and score, the same ultrasound examination indicators of symptomatic limbs with indicator and score, and contralateral limb with indicators and score. According to the obtained results of the scoring system for defining the risk of the postoperative complication, we have developed a scale of the level of risk complication in the postoperative period of patient with disease of the main arteries that underwent open and vascular surgical intervention. And accordingly, we have defined the risk of the development of postoperative complication in the case of aggregate points value for all direction of the research, and very high risk there is 3140 points, high risk 2130, medium 1120, and low risk from 1 to 10. So the lot of scales was developed, and each of them takes into account separate criteria of the pathology of organ and system and their influence of the main pathology. The suggested scale of risk stratification of development of complication of operative treatment of main arteries of the lower extremities in the postoperative period take into account the multifactorial nature of clinical and anamnesis and laboratory instrumental studies, consideration of the combination of factors that characterize the state of organs and system affect the choice and method of reconstructive surgery. In order to predict possible postoperative complication of the surgical intervention into great vessels of the lower limbs, we have defined a level of risk of developing complication by processing them by neural network clustering of indicated of clinical anamnesis and laboratory instrumental studies, followed by a narrow Excel classifier processing program. And based on the terminal level of possible postoperative complication, the main arteries, we have defined 4 levels of risk developing complication: 3140 as a very high, 2130 high, 1120 moderate, and 1 to 10 a low risk. Thank you very much for your attention and have a nice day.